Hello. Today we'll be talking about amniocentesis. Frequently, women decide to undergo further prenatal testing when there is a high risk detected by the serum screening conducted in the first trimester. One of the available comprehensive prenatal tests is amniocentesis, which is a procedure that collects a sample of amniotic fluid by inserting a needle into the woman's uterus. The sample is analyzed for chromosomal abnormalities, inherited genetic diseases, lung maturation, and evaluated for infection or illness. We will focus specifically on the chromosomal abnormalities and inherited genetic diseases. Consequently, parents face an ethical dilemma about the value of a disabled life, and specifically how it magnifies their responsibilities as a parent.
Amniocentesis is a procedure in which amniotic fluid is removed from the uterus for testing or treatment. Amniotic fluid is the fluid that surrounds and protects a baby during pregnancy. This fluid contains fetal cells and various chemicals produced by the baby. Your healthcare provider will apply a special gel to your abdomen and then use a small device known as an ultrasound transducer to show your baby's position on a monitor. Guided by ultrasound, your healthcare provider will insert a thin hollow needle through your abdominal wall and into the uterus. A small amount of amniotic fluid will be withdrawn into a syringe, and the needle will be removed. The small amount of amniotic fluid that's removed will be replaced naturally.
Stakeholders. The unborn child is the most evident stakeholder because his or her life is on the line. For example, if the results from the amniocentesis concluded that the child in the mother's womb had Down syndrome, then the parents may decide to terminate the pregnancy. On the other hand, the child may have to endure a difficult life if born with abnormalities. The decision to terminate the pregnancy impedes on the unborn child's right to life. The parents decided to undergo prenatal testing to search for any abnormalities, so they also have to determine if they want to proceed with the pregnancy based on the results. They face an ethical dilemma about the value of a disabled life. There are no treatments for the disorders detected by the prenatal testing, leaving only two options for the parents: abortion or raising a disabled child. Sometimes abortion is chosen because parents would prefer to raise a healthy child. If the parents decide to have the disabled child, then their parental responsibilities magnify. Also, lifelong care for a disabled individual is very costly. However, it is a wonderful gift to bring a life into the world. Physicians recommend prenatal testing for women with high-risk pregnancies. Medical providers are proponents of prenatal testing for a couple of reasons. First, the results empower parents with more knowledge. Second, the testing provides physicians with protection against wrongful birth and wrongful life lawsuits. Our first option is to limit testing opportunities for amniocentesis to those families with a history of genetic disorders. There would be no reason for perfectly healthy families to get tested, so preventing them from taking the test could lead to a decrease in unnecessary abortions. This could also decrease the risk of wrongful death lawsuits by limiting the number of invasive prenatal procedures. This would also free up money to spend on amniocentesis testing for families who are high risk and would decrease the children brought into this world who would suffer from disabilities. The second solution would be to ensure all families considering amniocentesis are in the right mental state to make this important decision by requiring a sign-off from a psychiatrist. This would overall decrease the risk of wrongful death lawsuits against physicians, the amount of unnecessary abortions, and in general would make sure parents are able to make more sane decisions regarding the results of the test as well. If you had a family history of genetic disorders, would you elect to proceed with amniocentesis? Why or why not?